Let me just introduce our first keynote speaker, opening our conference for us, Richard Judge, Dr. Richard Judge, Chief Executive of the Health and Safety Executive, the UK's primary regulator for work-related safety and health. And it's the HSE, the organisation and Richard's leadership, that makes the UK one of the safest places in the world to work. And the HSE itself has a really strong international reputation for effective and proportionate regulation, supported by quite literally a world-leading scientific capability. And what the Health and Safety Executive gets up to in terms of its approach spans activities from inspection, investigation and informal enforcement through to guidelines, campaigns and partnership that influence others to take action. So a little bit about Richard personally. His previous careers are in science and technology, so he's a good guy. His background is particularly in the environmental, rail and the nuclear industry. So the nuclear bit makes him a doubly good guy. For 5 years prior, he was the Chief Executive of CFAS, which is the UK government's foremost source of evidence and expert advice relating to the maritime marine environment. 3 years as Managing Director of a rail research organisation in the Netherlands. So we're really, really lucky to have somebody of Richard's stature and background as our keynote speaker and opening this conference for us. So thank you very much, Richard.
Morning, everybody. I think it's just wonderful, thank you, Richard, to be welcomed, first of all, by Richard saying, you know what, being up here is really daunting, 390 people, 42 countries, eminent people. Good luck. It really is a privilege to be here and just have the opportunity to share with you some of the work that we're doing in HSE, using data and bringing the power of modern data analytics, informatics, and all of the things along those lines to life by actually using that to save lives. So thank you for the opportunity, really pleased to be here. I'm going to start with a picture that some of you might know of Utopia. 500 years since Thomas More wrote his book on Utopia. His vision, quite a good place actually. You don't work more than 6 hours a day, which feels pretty good. Work-life balance sounds okay. I also suspect there's no email there, which is going to be another bonus. But if he's here today, in this room, with us, what would he be saying about Utopia in the context of occupational safety and health? I think if he was trying to bring that to life with us and actually talking about it, we'd be hearing about, first of all, just imagine of Utopia as a place where industry and innovation flourishes. That's where you start, that vibrant industrial community. But also a world in which no one dies as a consequence of their work, where catastrophic failures don't happen, and companies can genuinely look at their supply chain and say, you know what? Nobody was harmed in the making of our product. And a world in which, in all likelihood, we'd be seeing data being used, very clever use of data and analytics, to predict and then prevent accidents from happening. But of course, what's clear is we're not there yet. And if I just take some UK stats, in Britain last year, we had 137 people who died in work-related accidents, many of which I would feel were probably unnecessary. Maybe some 3,000 to 5,000 people who were injured and suffered what people would sort of loosely term as life-changing injuries. 12,000 people having their lives shortened by lung disease, normally related to past exposures to chemicals or dust. 1.3 million workers suffering from work-related ill health. And some 25 million days, that's 25 million working days being lost to the economy as a consequence. And all of that costs the UK economy some £15 billion. So we're not there yet. But I don't want us to be too depressed about this. If we compare the UK just to Europe, just under 5 fatalities per million hours worked. Here in Britain, we've got one of the best records in Europe, you can see that, and probably in the world too. And that gives us something to be really proud about, even if we know we can keep improving. But it gets tougher. And if you look at the trends here, you can see the trends coming down wonderfully and then hitting a little bit of a plateau over recent years. So even if we've improved markedly over 40 years, what we're finding now is the better you become, the harder it is to improve further, especially when at the same time the world is changing just so rapidly around us. So in recent years, we're starting to see those statistics plateau. But what we also know, we're absolutely aware of every day, every life lost is one life lost too many. It affects families, friends, and colleagues, and we're really determined to break through this plateau and to keep improving. Part of the answer in that lies in us making even better use of data. And that's really what I'm focusing on today with 3 examples of how we're doing that. First of all, how we're using behavioural insight research to work out how we can influence people. Then I'll pick up how we're using data analytics to bring together intelligence, which we get from a variety of sources, so that I know where my inspectors need to go and visit. And we can target those effectively. And third, I want to use the information we then gather, having been to sites and heard about what's going on, and learnt about what goes wrong when it does, to share learning and support the new ways of working which will achieve the ambition. Those 3 different ways of data, I think, are particularly helpful in combination. And I'll show that as a final example of how we can stitch it together in one. If I may, I'll just start with a little background on HSE, my organisation, as Richard said. It's Britain's health and safety regulator. And as you can see from the picture, we regulate quite a range of industries, from farms to factories, roller coasters to refineries, major multinationals to the very smallest family business. And a great advantage of that breadth is our ability to transfer knowledge and insight across sectors, so we can transfer ideas from one area into another. But within all of that breadth, what we see is a few constant themes. The first one, right at the heart of what we do, is our purpose. Basically, we're here to save lives by preventing work-related injuries, ill health, and death. The second common thing is our goal-based regulatory approach, in which we're expecting businesses to take ownership of health and safety, take ownership of their risks, and to put in place proportionate controls to manage those. And there's quite a strong element of self-interest there for businesses. What we see, safety, productivity, business performance, all tends to go hand in hand. There's almost a reason why wouldn't you? A third theme, and it's an important theme, and again referenced before, is how we use our multidisciplinary science and evidence to support our activities. We've got 550 acres of Peak District land. That wasn't today, you can probably tell outside, it's a bit sunnier. But nonetheless, a fantastic place with more than 350 scientists and engineers who apply their expertise in everything from the forensic analysis of when things go wrong to preparing us for a future world of work. And that capability in there, we've got some really powerful in-house data analytical capability and behavioural science expertise. And that's where I'll start, behavioural insight. So as you can probably imagine, with more than 5 million businesses in Great Britain, there's not going to be one size fits all. Our involvement ranges, which you can see at the top of the slide, from setting policy, influencing behaviours across whole industry sectors, all the way down as you go through the slide to the very targeted interventions on individual businesses that are getting it wrong, where we'll assess various controls and enforce the law. As a first cut, as you come through there, we focus on particularly industry sectors where risks tend to be slightly higher, or on maybe cross-cutting themes such as health or occupational lung disease more specifically within there. And if you want to find out about those, it's on our website under our sector plans. But even within a sector, what we see are very many different attitudes to health and safety. And what we know is if we want to influence those businesses, then we have to understand how best to do that. And so I'll just give you an example of research we've done targeted on small and micro businesses in the construction industry, where we were particularly interested in what was it which drove that sense of personal ownership for health and safety. And that's pretty important because what it does, that reflects how people see the legitimacy of rules and regulations and their willingness to engage. So our work loosely described 4 factors influencing ownership. I'm just going to unpack one of these, the first one, awareness and knowledge. And what you can see on the slide, it ranges from a high level, very trained, very knowledgeable experts in the field, all the way down through to, it's all common sense, I learn it on the job. Quite a range of awareness and knowledge on the way through. And if you pick that up on the other areas, you'll see a similar approach. So the experience is the experience of implementing health and safety systems. That can range from being quite positive, actually we did it, it helped us, through to those with very negative preconceptions that we just try and change our minds on. Personality, or personality of the business, the individual, the values, the beliefs of those people, as to whether they see health and safety as a burden or actually something which will help performance. And a professional identity, like the brand of their business. Are they interested in a brand of quality and high performance, or is their belief actually it's just short-term profit and that's fine? All of those things begin to influence how people take ownership of health and safety. And what we did is we used our research to characterize the types of people, types of attitudes that we might associate with different types of ownership. And that then affects what regulatory tools we choose to apply. You can see that a little bit in that ownership table, all the way up from the champions down to what we've loosely called the cowboys. What you'll see is the cowboys will tend to attract visits from our inspectors and probably a much more direct intervention than the professionals at the top of the table, who we might engage through industry events like this. But as well as targeting how and where we offer support, we're also using behavioural insight to ensure we strike the right chord when we go out. So, for example, we run safety health awareness days for farmers in the agriculture industry. And what we've done is use insight to rewrite the letters in a way that actually gets people to come along. And some small changes to those letters made a significant difference because we now get a very varied mix of audience, and we haven't even had to issue any reminders since we started using revised letters. So very practical things. We're also using our understanding to shift people through the levels of ownership. So in Wales, for example, we've had great support through the supply chain. Larger businesses, larger professional bodies are using their expertise, their people trusting them, respecting them, and we're using that to help raise awareness and share their knowledge and experience around smaller businesses. Just one of those, the Pembrokeshire Employers Engagement Project, so it's a mouthful to get out, PEEP's a shorthand, you can sort of see why they'd use shorthand, is now in its 3rd year. They've reached 4,000 people to date. With very targeted training days, which focus on how to manage risk in very specific sectors. Last time it was around healthcare and health and safety, and how they could access knowledge and insight on health, safety, well-being in that sector. Another example is a locker project. This is a learning program, which I came across, developed by students in colleges in partnership with leading health and safety specialists and supporters. And the great thing about lockers, it's raising and embedding awareness of occupational health issues in the next generation of workers, in the next generation of managers, directors. What they're doing is students are being given complete control over how they learned and how they recorded discoveries linked to lung disease and other occupational diseases. So they designed posters, they created films, they used their mobile phones, and they used all of that to show what they'd learned and shared those discoveries via social media to other students worldwide. Now, what works in there is we all know that learning's enhanced and retained probably for longer if it's fun. And I've got no doubt at all those sorts of programs will make a lasting difference to how they see health and safety going forward. Final point of ownership. It's one thing to define and improve levels of ownership, but equally we've got to make sure that we work on the ability of people to take action. And I'll just use this slide to illustrate that. So there's a number of factors, contextual and direct influences on an individual who might want to do the right thing, which would allow them and change their ability to do so. I'm not going to go through the detail of a slide, but one of them, which actually drives behaviours when people make decisions in the moment, shall I or shan't I take a risk doing that thing, which doesn't look quite right, but I'll get away with it, is very simply, I don't think I'll get caught. People might recognise that. And that likelihood of being caught takes me on to the next part of my presentation, which is about how we're using data analytics to target our visits, our interventions, so that our inspectors go to those places where people are at most risk of being harmed. So in doing that, we used in-house data expertise, able to do really clever things, or at least very clever to me. First of all, matching databases from completely different sources and dealing with those common issues you come across in databases of typos. So we're able to tell, for example, that Scotland and Scotland are likely to be the same place, which sounds small but makes a profound difference when you're trying to bring data together. What that's allowing to do is we can draw on a wide range of intelligence sources, bring them together into a single user interface. I'm not going to go into the detail. My teams are here. They'll be outside. You can find out more from them, who will actually give you the proper detail sitting behind there. But what we recognise is using Findit, which is a tool effectively for our inspectors. They can search and filter a variety of data sets, enabling them to prioritise their activities, to identify, locate, and get to high-risk businesses to do the work they need to do. So as an example in here, very simply, the sorts of question might be asked is, show me all the sites in an area where there's been an enforcement notice or a report of a notifiable injury to us between the 1st and the 5th of February in the manufacturing or waste sectors. So that might highlight some broader priorities for us in terms of what we're doing overall, and an inspector on the day can say, actually, I've got a bit of time, I'll go there. That's how it's helping us. And what we're seeing some really early benefits from this. First of all, straightforwardly, it's better prioritising our inspections to target and then take action. It's making the management of data and our communication of data much more efficient, and it saves us wasting time by going to somewhere where the business closed 3 months ago, but we didn't know. What we're finding is with Findit, which is a software tool, it's still evolving. We're accessing new data. We're beginning to incorporate new approaches, such as predictive analytics. We're also working with other regulators across government, so we start getting some different insights, all of which opens up also the scope for working across government much more seamlessly in multi-agency operations, which we also do. But at one point I would probably leave you with on Findit is people get very excited by the software and the clever technology, and it is great. But at the end of the day, what we're talking about is not a data science project, because if we want it used, it's a change management project. What we're looking for is our inspectors to be able to use that day in, day out to make their lives easier and deliver what we need them to do. And that's what creates a value. So once our inspectors have been to a site or we've been around, that brings me then on to the third area about learning some of the lessons from our visits, from the wealth of data that we hold, all of which is stored obviously within HSC, and we can use our knowledge base, our data analytics, to gain a much greater insight than perhaps we could historically from that wealth of data. So just one example from process industries. Our inspectors are there, they carry out safety walkabouts. You'd understand that if they're on a site, they'll go around. If they spot anything which concerns them, they'll make a note of that. and logging of inspection reports. What we're now doing is actually using data mining techniques, text mining techniques such as clustering, to begin to extract key data from those reports much more easily. And that's helping us to identify some emerging risks, emerging themes that are coming out. So if you're looking at asset integrity, for example, you might say actually there's inadequate documentation or inadequate recognition by the duty holder, the owner of or operator of a plant, to the risks that are coming from aging plant, or whatever happens to be. But if you begin to see the different inspectors on different sites in different places are picking up similar themes, what we can begin to do is then prioritise in our sector plans, which I referenced earlier, the priorities we need to address across the entire community of people who run plant like that. It also means our inspectors can get out to comparable plants and say, have you thought about, because we spotted this elsewhere? And all of that is helping to improve performance. So that's my 3 distinct examples. What I want to do is just bring them together in one final example linked to a campaign of around 2,000, and it's a rough idea, 2,000 inspections on small-scale construction sites. Your domestic refurbishments, extensions. If you're in London, your basements, you'll understand the size of project, that type of project. We might also choose to do that around a theme such as ensuring the health of workers. Are there welfare facilities? So before we go, we'll apply behavioural insight and we'll let people know we're in your area. Now the logic of that's very straightforward, because if you know you're in the area, many people who want to do something will do something before we even get there, and we might not get there and we'll have made an improvement without even turning up. We'll use behavioural insight, the are you compliant question mark there. That is not natural language for us in HSE. That actually is quite uncomfortable language, because we try and promote ownership by others and compliance feels prescriptive and we're telling people what to do. But what we know from insight is that compliance will actually make people think. So it's those sorts of things, just those little bits of behaviour which begin to trail our work before we even turn up. So during our campaign, we'll go out and about and we'll pick up using social media to the things that we see. We'll get conversations going on things that we see. There's an example here, and you'll see in the top left, the welfare facilities are there, but I probably wouldn't use them. Some extraordinary things, you look at it and think, really? But it happens, that's what we find. I'll give you one other one. Here's a video. I think it falls into the category of don't try this at home. And definitely don't try it within sight of the HSE office. This was filmed from our window. What I suspect, not surprisingly, we went out and we had a word. The person who did that clearly had forgotten that almost half of fatalities and a third of major injuries that we see are linked to falls from height. So after a campaign, actually, sorry, before I move on from this one, just on this one specifically, what we did here was we used social media, got it retweeted, and within 24 hours, it had reached a potential 80,000 people. Just the power of social media is really working for us in taking the work of one inspector on one site and making it bigger. It works. At the end of a campaign, in the same way that we trailed it, we'll tail it with a wider set of communications, talking about what we found, the analysis of the site findings, and hopefully that sort of shows you in one example around construction how tell during the consequence and tail of the campaign brings it all together, and of the various tools I was talking about. Doing that, and particularly in combination, we know is helping to save lives, and we see that. So I think that brings me just to close a little bit to our work with the Lloyd's Register Foundation. What we've realised, and probably known for a while, is that our ability to unlock health and safety data creates what we think is a unique opportunity to improve health and safety on a global scale. And as a starting point, with more than 40 years of data that we hold, in our archives, we've got a lot to offer. So I'm delighted that today we're announcing the launch of the Discovering Safety programme. The logo is here. It's a joint initiative led by us and Lloyd's Register Foundation, supported by others such as the University of Manchester through our Thomas Ashton Institute. And the aim of this programme, our aim, is to substantially improve health and safety, including in developing countries, by drawing on a multidisciplinary team that's able to aggregate and analyse health and safety data from sources around the world. We'll be using some of the tools that I've referenced today, such as the text mining, natural language processing, and also applying some leading edge and expertise in data science, data analytics, artificial intelligence, machine learning, etc. So as we do that, that will take us back to Utopia. It will help us make some really significant strides towards our modern-day Utopia, 500 years on from Sir Thomas More. So now in glorious technicolor, of a world where the risk of accidents can be predicted and therefore can be prevented, and a world in which no one does die as a consequence of their work. And here in the UK, if I bring it back to our work as HSE, the capabilities that we'll be creating with our partners through Discovering Safety, I'm sure will also help us to break through the plateaus I described earlier that we currently see in our health and safety statistics. So I'm really grateful to the Foundation, Richard, really grateful to you all and everyone involved in providing that support, and I'm actually very excited by the possibilities of what we can do next. So I'm looking forward to seeing the results and, more importantly, their impact as we use data to save lives, not just in Britain, but worldwide. Thank you, everybody.
Excellent. Got time for a couple of questions. Excellent. Richard, thank you so much for that. It's a real key example for us, for the Foundation, of working with and through other organisations to make the world a safer place. No better organisation than the UK's National Health and Safety Regulator. We've got 5 or so minutes for any questions. So if you've got a burning question for Richard, catch my eye. Gail.
And I've got a phone a friend. I've got lots of my friends in the audience as well, so if I get really stuck, I'll know where it's going.
Hi, I'm Gail Cardew from the Royal Institution. I really enjoyed hearing more about your behavioural insights and the segmentation of workers from champion to cowboy. I just wondered if you'd looked at the role of mental health and stress in terms of making people sort of nip out of their champion status, if you like, and go into a different category. So it's a kind of underlying root cause of people doing things that they might not otherwise done if they're not suffering from stress or anxiety or anything like that.
The honest answer is we haven't yet, but it's a really good example of the sorts of things we could do. So the Behavioural Insight team is relatively new in HSE. I brought it in 3 years ago when I joined the organisation, and we're building that as we go. So this is some of the early work, but a type of example to give mental health is absolutely the sort of application where you can begin to say, what are the pressures which might drive someone from normally working fine, maybe contextual factors, other pressures, which takes them into a different place than they might normally be. For mental health, actually, just having the link of that, thank you very much. I'll just hook onto that because one of the areas as a health and safety executive is for many years, we've seen fantastic progress on safety. What we're equally keen on, and have been again emphasising in recent years, is our need to be making the similar progress in health. And in health, there's sort of 3 areas we're looking at quite a lot. One is occupational lung disease. Another one is musculoskeletal disorders. So basically, how your joints and bodies work, depending on the type of work you do. But a third area is an area we're working in partnership with many others across government because there's lots of different facets to it, which is actually how can we support the broader agenda around mental health and well-being and stress. And that's an area where our contribution is around the work and the knowledge of a workplace and some of the things we can do in a workplace to support, if you like, the broader agenda. So the example of then beginning to hooking onto the inside, taking back. It's a lovely one. Thank you, Gail.
And if I could just build on that as well, we had our advisory council meeting yesterday, and Professor Richard Williams, who is here today, was helping us understand that in Industry 4.0, in the next industrial, the data and digital revolution that we're going to be going into, with robotic and autonomous systems, a lot of physical labour is going to be replaced by robotic and autonomous systems. And so physical safety is taken care of in some respects because man is taken out of harm's way. But what replaces it is really people's mental health. And it was a real, provocative thought for us in the foundation that as we go forward, probably one of the things that we need to be dwelling on in terms of making the world a safer place is, in addition to people's physical safety, well-being and mental safety as well. So we'll probably be thinking along the lines of doing more in that space going forward. So anybody else, anybody want to add a footnote to that or ask a further question?
Okay, well, my colleagues are outside and around, so if there is anything which crops up... Oh, sorry.
Oh, Anne-Marie. Yeah.
Thank you. It does work. Anne-Marie Warris for Eco-Reflect. Richard, interested in your comments about construction sites, because I wonder what you're doing about reaching out to people who employ builders, because I think that's probably one of the biggest reasons you have a problem, is that as an employer, as a user, as an extender, as somebody who wants something done, you don't understand it. Yeah. So how, are you thinking about that area as well, or whatever?
So a couple of things on that, and I probably, let me just amplify it a little bit. If you take very big construction sites, we have regulations which came in 10, 15 years ago on construction design management, and part of that is actually being very clear on the responsibility of a client, of a designer, and of a contractor, and how they fit together with a lot more sharing of information. It's worked very well for us and continues to work. Now, in large projects, people are well aware of that, very familiar of those issues. I think part of it is actually the domestic clients and how you get a message there. Now, again, there's two elements on the way through. There is the element of actually an architect-designed extension or whatever, the architect's responsibility and will share. But then there's the one which is actually, you know what, I'll just go and do this because I'm sure it will be okay. And I think that's probably an area where more awareness, continuing awareness needs to continue. So I would agree with the point. It's quite a hard, challenging one to do.
Excellent. Thank you very much. Any last questions? Anybody? Okay. Richard, thank you very, very much. That was spot on. Excellent. Thank you.